Healthcare inequality is a major issue and many people face it around the globe. Have you ever faced healthcare inequality? We had researched and found out that 29 countries had a high adult mortality rate and 23 had a high child mortality rate. All these countries were in Western and Sub Saharan Africa and Afghanistan. All these are poor countries and thus suffer healthcare inequality.
We had also reviewed a report of WHO and found the reasons for healthcare inequality include income, ethnicity, and many other reasons as shown.
We also found out that in low income countries, the average life expectancy is lower by 19 years than in high income countries, which is a very big difference. Every day, 16,000 children die before their fifth birthday, mostly in poor countries like those in sub Saharan Africa. Even in developed countries such as America, there is inequality in healthcare, and the African Americans represent only 13% of the population but account for half of the new HIV infections due to healthcare inequality.
For our primary research, we took an online survey of doctors and got 19 responses. And the answers show that they agree that it is a major issue in Pakistan that must be resolved, and they have provided certain solutions as shown to the issue.
We also took the interview of an international doctor and asked them questions which included is there healthcare inequality in their country and how governments around the world can eliminate healthcare inequality, and his answers are as shown.
We conducted the interviews of local doctors too to get their opinion. The first question for the first interview was, what are your views on healthcare inequality?
Healthcare inequality is a prevalent phenomena. It is a phenomena which is prevalent across the globe, and it is there in our country as well. अगर हम ओवरऑल दुनिया आलमी सतह पर जायज़ा लें तो हेल्थ केयर इनक्वालिटी मौजूद है. आप कोविड वैक्सीन की मिसाल ले लें कि किन ममालिक को जल्दी मिली और एक्सपायर भी हो गई, और जितने भी हमारे तरक्की याफ्ता कम तरक्की याफ्ता ममालिक थे उनमें देर से पहुंची. इसी तरह हेल्थ केयर के हिसाब से जो रिस्ट्रिक्शंस हैं वो भी आप देखते हैं कि वो इकोनॉमिकली एम्पावर्ड कंट्री और तरक्की याफ्ता ममालिक पर किसी और तरह से लगाई जाती हैं और गैर तरक्की याफ्ता ममालिक पर और तरह से लगाई जाती हैं.
The second question was is there healthcare inequality in Pakistan?
हम हेल्थ केयर इनक्वालिटी को पाकिस्तान में देखें तो येस इट इज़ एग्जिस्टिंग इन पाकिस्तान. वी आर डेवलपिंग इकोनॉमी और हम इकोनॉमिकली हमारे पास रिसोर्सेज कम हैं. दैट्स वाई नंबर वन हम बहुत कम जो है हेल्थ केयर पर बजट जो है दे रहे हैं विच इज़ मिनिमल एक्चुअली. और फिर जब इसकी डिस्ट्रीब्यूशन की बात आती है तो हेल्थ केयर फैसिलिटीज़ की जो डिस्ट्रीब्यूशन है वो भी वनरेबल ग्रुप्स के लिए काफ़ी डिस्क्रिमिनेटरी है. अगर हम इस इनइक्वालिटी को देखें तो इट इज़ एग्जिस्टिंग इन आवर कंट्री जेंडर वाइज.
The third question was what can be done to solve the problem of healthcare inequality?
सबसे पहले तो आई वांट टू से इफ़ वी वांट टू इम्प्रूव आवर हेल्थ केयर सर्विसेज there is a dire need to improve healthcare budgets. Government should allocate handsome budget to this sector. Secondly, if we want to remove gender inequality or class inequality in healthcare system or rural urban divides inequality in healthcare system, then there should be a strong monitoring mechanism from government sides. Policies should be strong और गवर्नमेंट को इनकरेज करना होगा डॉक्टर्स को कि वो रूरल एरियाज़ में भी जाएं, वहाँ पर भी काम करें. रूरल हेल्थ यूनिट्स जो हैं उनको इम्प्रूव किया जाए, उनको मेडिकल एप्लियंसेस दिए जाएं. एंड देयर इज़ अ डायर नीड कि सिविल सोसाइटी और आम पब्लिक भी साथ मिलकर काम करें.
Inequality in my country. मतलब it's apparent that there is inequality in my country. मतलब it's apparent that the healthcare inequality exists and in Pakistan, and मतलब obviously the poor don't have that much access to quality healthcare as compared to the privileged people of the society.
Presentation to show you. So this is the introduction to our topic, that what is basically healthcare inequality. So you can just go through these slides, and these are the causes of the healthcare inequality that we have gathered after our thorough research. And to these linked to these causes are these consequences of this issue. And for this for these we have an aim to have that we have set, so that we can improve this issue basically in our surroundings. So the aim of our project is that we can create awareness about this issue and suggest and identify some of the solutions to it, so that it can be brought to a lower scale. And our outcome is basically going to be in a form of a website and video. In the video, we are going to include this interview that we are taking right now. And we had also collected some primary data, which includes a survey which we conducted of multiple doctors, and this was the result of that survey. There were many other questions as well, but this is basically the summary of the survey. Secondary research, which means that the research that we conducted through media and web, and these were our findings, that this is not only prevalent in Pakistan but around the world, and especially in America, where African Americans face this issue. Then these are some of the courses of actions that we have suggested. So now we would like to ask you that how your perspective might have changed after going through these slides or the information that we have shared.
I just got to know from your presentation that there are even disparities in healthcare in America, and जो आप suggestions हैं they were also good. जिसमें हम लोग gender based जो भी inequalities हैं बाकी health general inequalities हैं उनको overcome कर सकते हैं. So,
this is going to be a final question, and Ayan is going to ask this.
okay.
Okay, so how can the governments around the world help to eliminate this problem?
Okay. The governments can focus for, matlab, obviously we cannot we can just take one step at a time. So as a doctor working in a rural health dispensary, I have interactions with many of the patients who are not sure economically well off, and their health even. And so as a doctor working there, I would my suggestion would be that the government funding should be increased in the peripheries. The peripheries should be well equipped. There should be a resource allocation in the peripheries होनी चाहिए, because अगर आप peripheries को आप stable करोगे, then the load on the tertiary hospitals would be less.
For pre and post evaluation, we went up to our Instagram account and uploaded our research. We asked them how their opinion has changed. The most valuable response was the one highlighted in blue, as it covers the reasons for and against his before and after perspective.
From all our research, we have come to the conclusion that it is a big problem globally that needs to be resolved before it continues to destroy innocent lives.